Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Whether you're a professional athlete, a high school athlete, or a weekend warrior, reaching peak performance is a common goal. Everybody wants to be at their best. But what makes the difference in your ability to perform? Why can some professional athletes seem to defy father time and continue playing at a top level into their 40s? What sets the elite athletes apart?
I can think of one quarterback who's doing a pretty good job of that.
At age 40.
Playing this weekend, as a matter of fact. Well, here to discuss sports performance is Mayo Clinic anesthesiologist and human performance expert, Dr. Michael Joyner, wearing the most fabulous Bart Starr jersey I've ever seen.
How can you be a Minnesota fan and say that?
Because I'm a Packers fan, just like Dr. Joyner.
From South Dakota, and you're a Packers fan?
Where are you from, Dr. Joyner?
I'm from Arizona, but my wife and my extended family's from Green Bay.
So you got it. She made you wear that.
I don't have a choice.
She dressed you this morning, didn't
You do
she?
not have a choice.
So, Dr. Joyner, you've been at this a long time. You're a human performance expert. And by the way, you have just received an Outstanding Investigator Award from the NIH. Congratulations.
Thanks, Tom.
They're going to fund your lab for the next, how many, 70 years or 7?
7 years.
Yeah, 7. That's pretty good. Good for you. So tell us, in your experience, what makes an elite athlete elite?
Well, I think obviously people have to have some ability. They have to be consistent. And I think if we think about 5 or 6 things with Tom Brady that have allowed him to continue to perform at a high level, first, he's got a lot of ability. Second, he's on a good team. Third, he's avoided catastrophic injury. And you know this, Tom, from orthopedics. He did have an anterior cruciate or ligament injury to his knee, but he had it in the era of modern orthopedic surgery when they were able to repair those things relatively slickly as opposed to somebody like Joe Namath. He's also played in an era when the rules have favored quarterbacks.
Sure.
The in-the-grasp rule, the pass coverages, the holding rule, all that's changed.
Bart Starr might still be playing today if he could be performing now.
You bet he would be. And I think the other thing is that he works out regularly, follows a rigorous diet and exercise program, hasn't gotten fat, and really has not succumbed to some of the temptations that athletes and rich people in general come to. And then finally, I think he really, really cares. So I think when you add those 6 things together, you mix in a little Bill Belichick and Robert Kraft, I think you really get greatness.
And you look at his wife, and he does want to go home at night, don't you think?
Stop. Oh, my gosh.
But he practices really hard, doesn't he? I mean, every summer, he's out there throwing passes and throwing footballs and trying to get better. I mean, you've heard the phrase, talent is not enough, or there's even a book called that. But that's true, isn't it?
It sure is. And I think one of the things that I find most interesting, and one of the most interesting things on ESPN was the quarterback camp run by the Mannings. Eli Manning and Peyton Manning used to go back to their college coach every spring and do spring practice with the classic footwork drills and everything else that they did as young quarterbacks so they could continue to master the fundamentals. One of the most interesting things about the Golden State Warriors, who run a terrific 4-year run in the NBA, is that Steve Kerr, when he came to the Warriors, instituted a number of very, very fundamental drills. And the guys complained about it. Then they won 10 games in a row and wanted to do more. So if you see this over and over again, you see this mastery of the fundamentals.
Fundamental drills such as?
Footwork, jump rope, passing, catching, how you plant your back foot and throw a pass. I mean, just these very stereotypical quarterback drills. Brady does them every day.
I remember hearing, maybe it was about baseball players more than anything, but that there's a lot of them that were getting into yoga and Pilates and that kind of stuff. Is that still something that these pro athletes do?
It varies from time to time, and typically what happens, whoever is best, people emulate.
Sure.
But you do find that people work on their flexibility, work on their strength, work on their speed religiously. You know, we were talking earlier about Bart Starr. And there are tremendous YouTube clips of Vince Lombardi going around or going down and individually coaching people on their footwork. So this idea that he was some sort of tyrant, while true at one level, is not true at another level. He was a great teacher who had his players focus intensely on a few fundamentals.
You know, we want to talk a little bit more about Tom Brady and what diet has to do with performance in his new book. But also, before we do that, mention Roger Federer. What's the deal with Roger Federer? 36 years old, just won his 20th Grand Slam.
You bet. In a brutal individual sport.
Yeah.
There's no team to hide behind. There's no offensive lineman. And if he declines a little bit, it's not like the rest of the team can make it up. He's playing Rod Laver, who is among the greatest and maybe the one rival that Federer has as greatest of all time, who's in his late 70s, said that he couldn't really detect any change in Federer's play. He said if he had slowed down, he'd become so much better strategically. He was now able to exploit his subtle advantages over other players. But Federer's another example. Federer works extremely hard. He had a one knee problem. He avoided catastrophic injury. The other thing that's interesting about Federer as he's gotten older is he picks and chooses. He doesn't play as much. He avoids the French Open because he's not good on clay. And he focuses on the Australian Open, Wimbledon, and the U.S. Open, and he continues to do it. And he, too, is a conditioning nut. He hasn't gotten fat. He pays close attention to his family like Tom Brady does. And so he seems to, again, go after the fundamentals.
Yeah, it's truly interesting. A part of it is luck, isn't it? I mean, to avoid the injury like Brady has and Federer has. So many tennis players have an injury and they succumb to it and they really never come back. Roger Federer and Tom Brady have both been able to avoid a serious injury. I think you mentioned
the leg injuries they've been able to overcome because of better orthopedic surgery, but they haven't had shoulder, elbow, hand, arm, neck, back problems. And one thing, if you think about whether it's those guys, whether it was Dara Torres, who we were talking about a number of years ago at age 40 and in the Olympics in swimming, or one of the things you don't think about, we don't talk about it as much as we used to, is the great Bernard Hopkins, the fighter, who I think was world champion when he was 49 or 50, and Hopkins did exactly the same thing. He had a strict diet, worked out religiously, and avoided all sorts of temptations. And what was most interesting in Hopkins' case is like a lot of boxers, he'd had an interesting early life, and I think had been in prison at one point when he reformed himself and became world champion, and subsequently has had no problems.
So how much does diet have to do with peak performance?
Well, one of the things that's quite interesting about it, Tom, is that, as you know, Tom Brady's published this book with his diet, and he's getting a lot of publicity. And they ascribe all sorts of things to all sorts of special things with this high alkaline diet and so on and so forth. But what you, in reality, see when you zoom out is that he restricts his food choices, and that's one of the ways you avoid weight gain as you get older. You restrict your food choices, you have a plan, you stick to the plan, and at some level within reason, as long as the diet hits a few key points, you're fine. And that's what all of these people do. So I would say Mr. Brady's diet is right for the wrong reasons. It's not because there are some special ingredients or special things he avoids. What he's avoided is overeating.
Yeah. He doesn't. Yeah.
What he's avoided is too many calories, and there's also
it's amazing how that helps you lose weight
or keep it off. And then there's this issue too with his workout plan. He has all this stuff about muscle pliability. Well, if you talk to your friends in biomechanics and muscle physiology, they have no idea what that means. But what it does mean is he works out religiously every day.
Now, there was an article in Vox, which is a general interest news site for the 21st century, they claim, and you're quoted in there. And it's about Brady's book called TB12, the TB12 Method. I think there's a fair amount of pseudoscience in there. But one of the things that he claims in his book is that the right foods, in his word, are alkalizing and anti-inflammatory. Is that true?
Well, certainly there's some evidence that the Mediterranean diet, which tends to be, quote, anti-inflammatory, and the olive oil and things like that, can help you stay in a little bit better shape and help you avoid weight gain and prevent cardiovascular disease. But the type of inflammation he's talking about and the alkalinization he's talking about are way out there. The most important thing about his diet is he has a diet he can follow. It's a diet that prevents him from gaining weight, and it provides the macronutrients he needs to recover from his games and practices.
But there aren't any foods that you can eat that will actually change the pH of your body, are there?
It would be very, very difficult, Dr. Shives, and you would have to have kidney disease or something else going on. But your pH is tightly regulated, and your kidney and lungs take care of it. And we've done studies in the old days when I was a medical student where we actually fed people baking soda, which... And huge amounts of baking soda in an effort to alkalinize their bodies.
So raise their pH.
Raise their pH, and you can do it, but boy, you got to eat a box of the stuff.
You're also quoted in the article as saying the only post-exercise diet that's been shown to speed recovery is getting enough carbohydrates to replenish glycogen that's been depleted after a workout, or protein to help with muscle building.
Well, and that's the whole chocolate milk pitch. what's been shown many times is that if people do a couple of hours of strenuous exercise, they need to get the glycogen back in their muscles. So that comes with the carbohydrates. And there's a window of time, especially after a strength workout, where your muscles are sensitized to take up amino acids and synthesize new protein and recover from that workout. That's within an hour of exercise. So a protein load, like you would get in chocolate milk, and a carbohydrate load, like you would get in chocolate milk, turns out to be an ideal post-exercise beverage.
It's the reason why they hand it out at the end of all these races, you know.
Yeah, well, I guess with good reason.
That's right.
And it's not just theory; it's actually fact.
Oh, it's been shown many times actually, and there was some classic studies from Scandinavia done in the late 90s and early 2000s.
All right, Mayo Clinic anesthesiologist and human performance expert, Dr. Michael Joyner. We've been talking about sports performance, being at your best. Time for a short break.
When we come back, we'll turn our attention to the next big worldwide sporting event, the Winter Olympics. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We're back talking with human performance expert, Dr. Michael Joyner. He's also an anesthesiologist on the staff at Mayo Clinic. He's obviously a Bart Starr fan, number 15. But
Very handsome.
Yeah, who are you rooting for this weekend?
Well, I'm for the Eagles because Nick Foles went to the University of Arizona and I went to the University of Arizona. And as one of my young sons has pointed out, Doug Peterson was Brett Favre's backup. On the other hand, Gronk went to Arizona, so I can win either way.
All right. I just have to ask, because I'm not going to ever be in the Super Bowl, nor probably even attend a Super Bowl, nor the Olympics. So what the things that we've been talking about here, being better performance, a good diet, what tips do you have for a weekend warrior, someone like me who just likes to run and go skiing and be active?
Be consistent. Find something you like to do and do it.
Not cross-training?
You can cross-train if you want to, and cross-training is terrific, but find something you like to do.
Okay.
Avoid injuries. If you're injured, you can't be physically active. As you get older, and most people don't have enough time to train for the triathlon, so they can eat whatever they want.
Gotcha.
So most of us do have to watch what we eat if we want to keep our weight in check. Those are four things in care, but I think consistency, having a plan, sticking to it, and so forth. So if you look at diet, people have done tremendous studies where they've compared all sorts of different types of diets, and at the end of a year, everybody lost the same amount of weight on these 4 or 5 different kinds of diet. But the only thing that really predicted how much weight they lost was their adherence score.
Yeah,
So
sticking
to it.
So I understand that you and our producer Jen O'Hara are now going to the gym. Are you being consistent, and have you changed your diet? I mean, you're both looking pretty buff.
Well, we're trying to do strength training because we both she plays tennis, I go running, but we're trying to do strength training because we're getting to be middle-aged, and that's important, especially for women, to increase their strength training.
It's important for everybody when you get into middle age. 70% of 70-year-olds can't get off the floor. As people get into their 60s and 70s, traditional risk factors like diabetes, hypertension, cholesterol start to play a lesser role in predicting how long you're going to live. Things like grip strength, can you get out of a chair, how fast you walk, things related to muscular strength become much bigger predictors of A, your survival, and B, how independent you are.
We're going to keep you in line, mister.
Oh, well, I know that, yeah. But let me tell you what, I can still get off the floor.
That's good. That's good.
Let's talk about the Olympics. South Korea. Do you think the athletes will be better, faster, quicker, more agile than ever before?
Well, I think there's 2 big stories coming out of South Korea. One is that the South Koreans and the North Koreans seem to have some sort of détente going on around the Olympics, which is interesting when you just think of all the noise
I'll
about
have to be a fly on the wall.
about the Korean Peninsula. The other thing is that Russia's been banned, but Russian athletes are still allowed to participate, and Russia was banned because of the systematic doping that was uncovered at the Sochi Olympics. But
In all levels of their program.
from top to bottom.
Wow.
What's interesting about that is Grigory Rodinnikov, the whistleblower, and I were sitting next to each other in 2014 at a conference in Eugene, Oregon. And throughout this entire conference, he and I were chatting, and he kept making these very cryptic comments to me. And then he blew the whistle, and I read in the New York Times, Washington Post, and other places about what he had said. And all of a sudden, these comments made sense to me.
So how did they catch him? Is it a blood test or urine test?
Well,
or how do they? And aren't there lots of ways that you can circumvent that test?
Yeah, and what Dr. Rodinikoff showed is just how they did circumvent things, switching out urine samples and so forth, putting things in their urine that would mask drugs and so forth. But I think the thing we've learned really since the days of Lance Armstrong is microdosing. So the cutoffs for what constitutes a positive test for most doping control efforts are way out there because they want to avoid false positives. So they're at the 99.9 percentile. So you're only going to catch people that are doing industrial strength doping.
I think one of the times
microdosing works.
Yeah, one of the times I've interviewed you, you said the thing is that they're always just a step ahead of the tests being developed to catch them. So it just is always going to continue that way.
Well, and again, thinking about Lance Armstrong, if you look at the Tour de France, it takes about 80 or 90 hours to do the Tour de France. Maybe 10 hours are competitive for the top guy, so it's 600 minutes. He won between by about 1 minute and 7 minutes. So that's less than 1% or less, essentially. So they're looking for tiny, tiny edges that are very difficult to detect. And with the cutoffs set so far to the right on the bell-shaped distribution and designed to avoid false positives, it's really hard to do.
And when we talk about doping, what are they doping with? Steroids? Is it mainly steroids?
Steroids is one thing, and there are three main things that people dope with, Tom. Things that build your muscles and increase your strength. Things that reduce fatigue, most notably amphetamines, but those are very easy to test for, so you hardly see any of that anymore. But that was the big news 20, 30, 40 years ago, 50 years ago. So things that build muscle, which are steroids and growth hormone. Growth hormone is tough to test for. And things that increase oxygen capacity, which would be either EPO or old school blood doping with transfusions.
So tell us about EPO. What is EPO? And is that what Armstrong was doing?
Armstrong was doing EPO, and then there became a better EPO test, and he started doing traditional blood doping. EPO is
What's blood doping?
Blood doping is when you take your own blood out, your body then creates more blood cells, and then you reinfuse that blood a month later.
So your body can carry more oxygen.
More oxygen.
More blood.
More blood, more oxygen. And EPO is essentially a pharmacologic way to do that. Erythropoietin is a substance secreted by your kidney, which makes your bone marrow make more red blood cells. It's been a terrific medical treatment for anemic patients and a wonderful thing, but it's been abused when people want to go faster on their bikes or on the track or in the pool.
All right, so there's lots of different ways to try and increase your performance,
it's
many of which are illegal.
The illegal ones are a devil's playground.
All right, well, we're looking forward to the Olympics, and it should be good. And as you mentioned, interesting that the North Koreans are going to be there. And you said the Russian athletes are going to be there, even though they've been banned?
The Russian team has been banned, but there are selected Russian athletes who apparently have passed enough drug tests who will be permitted to perform under some sort of independent flag.
All right. Mayo Clinic anesthesiologist and human performance expert, Dr. Michael Joyner, recent recipient of an Outstanding Investigator Award from the NIH. Congratulations, and thanks for being with us, Dr. Joyner.
Great to be here, Tom.
Still to come on Mayo Clinic Radio, we'll learn tips for preventing ACL injuries. And later on in the show, how regenerative medicine is being used in sports medicine.
You're listening to the Mayo Clinic Radio on the Mayo Clinic News Network.